Hi, I'm Dr. Suresh Babu. I'm working as a senior consultant nephrologist for Yashoda Hospital, Secunderabad. On occasion of this World Kidney, I'm going to speak about a few tips how to keep your kidneys healthy. Before going to proper tips, I would like to have some clarification about the kidney failure. Kidney failure, broadly, we have two types. One is acute kidney injury. That means the kidney failure lasting for few weeks. Suppose a person has some loose motions, gastroenteritis, dehydration, cardiac failure, liver failure. In snake envenomation, any insect bites, these things can cause the acute kidney injury, which lasts only for a few weeks. In contrary, there is what is known as a chronic kidney failure. It is notoriously known as chronic kidney disease. It means the kidney dysfunction lasting 3 months or more than 3 months. The chronic kidney disease, the most common factors or causes are diabetes and hypertension. Although these two contribute to 2/3 cases, all cases of chronic kidney disease, in young individuals, we should not forget other causes like chronic glomerulonephritis, the congenital disorders, genetic disorders, and there may be some abnormalities from the birth. Now, come to the tips to keep your kidneys healthy. The first and foremost, I can say, the periodic testing for the kidney diseases. You know that the kidney disease in early stages, the patients do not manifest any symptom. So to detect the kidney disease in early stages only by testing. What tests you can do? The simple urine test for the protein, and another one is commonly known as creatinine in the blood. These two tests are enough to detect the kidney disease in early stages. Why it is so important? You know, approximately 1 in 10 adults probably having the chronic kidney disease. Unfortunately, major of them, they don't know they have the disease. So the early detection should be done, and it is only possible by the testing. How often you need to get tested? So you need to get tested at least once in a year. When to start? So all, whether risk factors are there, you have to better to start testing from early childhood. Those who have the risk factors like diabetes, hypertension, and the family history of kidney diseases, in these patients, more often you need to test to know whether they have a disease or whether there's a progression of the disease. The second important tip is what usually we forget is our daily schedule. So cultivate regular daily schedule. Why it is so important? You know, we have a many biorhythms. That means when we wake up, like when you sleep, when you eat, all should synchronize with our biorhythm. Whenever there is a change in this your routine schedule, it alters your biorhythms. So alteration in the biorhythm causes chronic inflammation, which is responsible for the progression of the any organ dysfunction, not only chronic kidney disease, even heart disease, liver disease, any chronic organ failure. So keep always eye on your regular daily schedule. The third tip is taking adequate fluids and water. What is this adequate water? We know we always listen, you take 3 liters, 5 liters, 10 liters. So what is the exact adequate liter? Adequate fluids. This means usually you need to produce at least 2 liters of the urine every day. Of course, it is very difficult to measure. You can roughly have to assess at least 2 liters of urine whether you have passed or not. This urine is depend on your weather condition. Suppose you are in a summer like 45 degrees, 43 degrees. So Unless you take like 10 to 12 liters, you may not get 2 liters of the urine. What is other best way to know how much fluid I should take? Your thirst. So thirst is very important. As per if you follow your thirst, that is ensure that you have a adequate fluid intake. So two things: adequate urine and following your thirst probably give a clue that whether you are adequately you have taken the fluids or not. The next one is the healthy food. What is meaning of healthy food? You have to remember that the salt, sugar, fats, these three things must be low in all the foods. So in other words, you need to take a balanced food, adequate vegetables, fiber, protein. So these are all you need to take in a balanced way. So balanced diet is very, very important to keep your kidneys healthy. The next comes keeping your gut healthy. What is its mean? You know, your gut has almost 100 trillion bacteria. So majority are the friendly bacteria. Suppose these friendly bacteria turn out to a bad bacteria, again it leads to chronic inflammation in your body. Again, this leads to worsening of kidney functions and organ failure. How to keep these friendly bacteria in your gut? So taking again vegetables, avoiding these fat foods, taking more carbohydrates. Like naturally, if you practice taking a healthy food, naturally your gut microbes are definitely going to be friendly. Then keep yourself fit. That is, to keep yourself fit, you need to have a proper exercise. Again, what is meaning of proper exercise? It means at least 30 minutes at a time, 3 times in a week. You need to sweat when you do exercise. That is called adequate. If you do in that way, that is enough to keep yourself fit. If you are a diabetic, you have to check your sugars periodically and get it under control. Same so as the blood pressure. You need to have a periodic checkup of your blood pressure and you need to get it under control. Another important thing is use of the painkillers. You usually go to medical shop and you take the painkillers for any pain like headache, backache, leg aches. So these painkillers must be avoided. This chronic kidney disease due to the painkillers is emerging as a very important cause for the chronic kidney disease. So these are all the health tips to keep your kidneys healthy. Suppose you are detected you are having a chronic kidney disease. You don't become panic. So chronic kidney disease, major of the times we can delay the progression of the disease. That means to go to dialysis stage, we can delay. The second is, despite having the disease, the quality of life is maintained with present medication. So chronic kidney disease can be treatable, preventable, and major of the times we can able to maintain your quality of life despite having the CKD. Thank you.